Okay, we've covered a lot of ground, and we may have made some mistakes, or we may have left a few things out. This is Tara Kulash with the St. Louis Post-Dispatch. Your beat is what we're talking about tonight. You're on the Affordable Care Act beat.
Yes.
So that means there is a lot of information to be covered if you have a beat dedicated to a law.
Mm-hmm.
So how are we doing tonight? I see you have, this is how we know you're a reporter. You have the reporter notepad. This is good. And I can't help but notice, but it's full.
It is. I was taking a lot of notes. Actually, I think that the group did a really good job tonight of kind of outlining the Affordable Care Act, saying the main points. I do think there's a few things that I should bring up, though.
Yes.
So yeah, they were talking about how the young invincibles, that we need more people signing up to keep our rates lower.
Yeah.
Okay. That is important. First of all, we're noticing at least in the first year of the insurance the marketplace being open, people having coverage, deductibles are going to be high because they're not expecting a lot of people yet, or they're not sure how many people will sign up for this, and they don't have a whole lot of insurance carriers who have bought into it yet. So they need more people signed into it.
This is the critical mass has not been reached to be humming along at its optimal level.
I guess you could say they don't really. I mean, it's nothing. It's a gamble. It's a gamble, is what it is. That's the best way to put it. But something that's really important is how the middle class is going to be affected. So you've got these subsidies that are really going to help people with their premiums, and that's great. But a lot of people in the middle class won't be receiving subsidies, and a lot of it is because of their employer coverage. Now, if you go into the Kaiser Family Foundation, they have a subsidy calculator online. That's a really important tool to use. So if you look on that, it asks you if you have affordable coverage through your employer. And if you have affordable coverage, you are not eligible for subsidies. Now, what deems you eligible for subsidies is, I guess, your work coverage. It has to be, let's talk about you, for example, okay?
I love to do that. It's my favorite topic.
Let's say you have 2 kids and a wife.
Okay.
On your coverage, by yourself, it's about $50 a month on your premium. That for you is affordable. The definition of affordable for you is it has to be less than 9.5% of your yearly income.
Okay.
Now, with your family added onto it, a lot of times it's a lot more expensive. It could be $500 to add more people onto this, okay? Right. The way that the Affordable Care Act works, though, is it only defines whether it's affordable based solely on you. So it would look at what the coverage is for you, how much it costs for you, and if it's affordable, then it considers your whole family gets affordable coverage through your employer, and therefore your family is not eligible for subsidies.
Are people considering that a flaw here in the law that they want to address, or is there?
I've talked to brokers who say so. Yeah, they say that that's a lot of middle-income families are going to see really high rates, and it's really going to hurt their budgets. Definitely.
You have more things on the list?
I do have more things on the list. Another issue right now, I know that navigators are really trying to reach out and help people, and that's very important, but I mean, the problem in Missouri is that they have a very low advertising budget. So word is really not getting out to people who are trying to find out information about the Affordable Care Act. I think a lot of people don't even know where the navigator locations are well enough. So I hate to shamelessly plug myself here, but the news is the place to turn here. We are the people that are studying this every day and trying to help people. And anytime someone calls us with a question, if we don't know the answer, we study it and we answer it for them. I do know that the St. Louis Health Department is having 2 days a week through mid-December. They're holding informational and enrollment sessions. And I've posted the whole schedule to that to mohealthreport.com. And you've got the People's Health Centers. They're on Delmar, and they have 2 other locations. And they're having certified application counselors with a table in their lobby and signing people up. So there's all these locations that people can go to that I don't think that many know about. There's also navigator locations that it wouldn't be a place that you would exactly guess. There's one place that's called Certified Processing Corporation, and they do marketing for agents, for brokers.
Okay.
So a consumer wouldn't necessarily think, I think I'm going to go look at Certified Processing Corporation. I bet they have navigators. So the problem is that people aren't really realizing where to find these navigators. And in Illinois, they've got $115 million advertising budget. Missouri has $4.74 million budget for advertising. So there's not as much outreach going on out there, especially it's mostly the small clinics and the federally qualified health centers that are doing the outreach, but they're getting a lot of their stuff from Missouri Foundation for Health. They're just getting some free brochures. They spent most of the Missouri budget was spent on hiring and training navigators.
And we're all about shameless plugs. In fact, the good folks, you only have to remember one thing: 9net.org/health,
Yes.
and we'll
Mo Health Report.
And what I was just going to say, we'll get it all in one place there and make sure that people can find it. I'll ask you kind of what I asked Lisa when her reporting and your reporting: frequently asked questions, frequently confused issues. What are you seeing when you talk to people?
Yeah, a lot of people confused. I mean, just look at the statistics of how many people don't know about the marketplace, don't know. They're confusing the Affordable Care Act for Obamacare. Just the other day, I was reading some comments online on one of my stories. There was a bunch of people commenting, getting into arguments. And one guy started calling it HoCare. And I thought, what is this? And I started trying to Google it. I couldn't find anything on it. And another person commented and said, what does this mean? You're just trying to confuse people more. And he said that he's calling it Hussein Obamacare. And it's just, so people are really throwing out all this slang, different terms for it, and it's getting people confused. And then when you've got the lack of advertisements or, more outreach, we just need a lot more outreach.
The way we get information is
yes.
Scattered.
Yes, very.
Okay.